With ImpacTalks, we celebrate the power of storytelling.
Now, without further ado, I'm going to introduce our first ImpacTalk speaker. And, I just want to say, these folks are here to teach and inspire you, but you're also here to root them on, because they've worked hard, and they have amazing, amazing stories to tell. Get ready. So our first speaker, Kenneth Gilliam, is a policy associate at Virginia's Commonwealth Institute for Fiscal Analysis. Kenneth is a key contributor to TCI's work to advance opportunities and reduce inequity through changes in education and healthcare policy. He coordinates Healthcare for All Virginians, a statewide coalition of more than 100 organizations working to help create and advocate for accessible and affordable, high-quality healthcare for all. That's very, very important. This coalition, as Kenneth will soon tell you, was the driving force in a tremendous victory last year that enabled 400,000 Virginians to access health coverage. Please join me in welcoming Kenneth to the stage.
Here is a picture of my grandfather, Federal. Growing up, he was one of the coolest dudes I knew. He stood at 6'2", always had a fresh perm, and he would frequently take me joyriding in his hunter green Cadillac Seville. And many of my fondest childhood memories involve spending time with my grandfather during humid Virginia summer nights. And he and we would stargaze while listening to the chorus of cicadas around us as we slowly sipped sun tea from my grandparents' old mason jars. And during those humid Virginia summer nights, my grandfather would teach me the importance of providing service and advocacy for my community. And those important lessons served as guiding stars for me during Virginia's Medicaid expansion fight, because this victory for Virginia families, it wasn't an easy one. And for 6 years, and even after defeat, the Commonwealth Institute and the Healthcare for All Virginians Coalition, we never gave up on this key issue. Together, we continued to educate the public about the benefits of expansion. We kept heat on key lawmakers, and we worked with one-time opponents to find what we affectionately called a pathway to a pivot, so that they can see their way clear to supporting access to health coverage for nearly 400,000 Virginians. So I want to tell you all, that story of how we fought for those nearly 400,000 Virginians, and one, taking the single biggest step our state has taken in recent history to advance economic opportunity for all. And as I tell this story, I like to think about it in 4 major themes. And to be honest, I borrow these themes from a common phrase that I'm sure that many of you here in this room have probably heard of before. They are something old, something new, something borrowed, and something blue. And just to provide context for our story, let's first start with something blue. In Virginia, we long had support by both Republicans and Democrats on this key issue. However, we didn't have enough support. That all changed during our November 2017 statewide election. In Virginia, our House of Delegates had long been the stronghold against expansion. That's because the majority in our House, represented here in yellow, they largely didn't support expansion. However, during this election, 15 candidates who all campaigned on Medicaid expansion, they picked up 15 additional seats in our House. And that shift in our political landscape created a key opportunity for us to make the most on this key issue. And though there was a significant amount of new supporters in our House for this key issue, there was still a significant amount of work that needed to be done. And that's when TCI, we really relied on something old, our budget research and analysis. Budget research and analysis is the bread and butter of what we do at the Commonwealth Institute. And during this fight, our partners, they really relied on us to provide credible research and analysis, making the case for expansion. A key product that we developed is our How Medicaid Works chart book. It is an easy-to-use product that explains how our state's current Medicaid program works, how it could be improved through expansion, but also how it can help address our state's economy. Another key and old theme that we really relied on is this idea that it's all about the right message at the right time with the right messengers. And during this fight, we long felt that we had the right message. And after the November 2017 statewide election, we knew that it was the right time to get this across the finish line. But something that we realized, we weren't necessarily always the best messenger. So something different that we did this year was that we worked with more conservative partners, and we provided them with unbranded research and analysis in our advocacy materials that they can give to lawmakers carrying our key messages. And what do we learn from this experience? Our research analysis, our talking points, our advocacy materials, they all work. But sometimes they have to be unbranded, and we aren't necessarily always the best messengers. In this experience, it was something very new and interesting for TCI. But TCI, we really learned something new. In June of 2018, when we went to Chicago for SPP convening, where we learned about a new tactic called the Ring of Fire. And I must be honest, before I went to Chicago in June of 2018, the only Ring of Fire that I knew about was from Mrs. Comer's 8th grade Earth Science class. And in her class, she taught us that the Ring of Fire is this area in the Pacific Ocean that is known for its number of volcanoes and active areas of earthquakes. But y'all, turns out, there is an entirely different Ring of Fire that I did not learn about in Mrs. Comer's 8th grade Earth Science class. And it was crucial to our Medicaid expansion fight in Virginia. When we went to Chicago, the center, they taught us about their Ring of Fire. And really, it is a way for us to think about what are a set of maybe 3 to 5 tactics that we can deploy on a smaller scale that can help folks in our state lift up their voices about their key issue. So when we went to Chicago and learned about the Ring of Fire, we deployed that in key communities throughout our state to help Virginians stay abreast of the issue, but also to help lift up their voices. And this really paid off for us in a big way. Virginia's Medicaid expansion victory isn't just a victory for us in Virginia. Really, it's a victory for all of us here in this room. To deploy an effective campaign that helped nearly 400,000 folks in our state gain access to the coverage they need, we borrowed from the resources of our network and leveraged the strength and collective power of their SPP network as well. For example, our friends in North Carolina, they inspired us to think about how we can really connect the dots about how Medicaid expansion can also help address other key issues, such as our state's opioid crisis. Our friends in Georgia, they, before our 2018 legislative session started, they shared their campaign plan with us. So it was a good way for us to think about, to compare notes, but also to see if there are any key components that we're missing from our campaign plan. So taking the combined lessons learned from Chicago, leveraging the resources of the folks here in this room, and also the great staffers at the center, it really paid off for us in a very big way. Because on March 30th, 2018, the Virginia General Assembly passed a state budget that included Medicaid expansion. We won. We finally did it. And we were all able to do this by making the most of a key window of opportunity. deploying both old and new tactics, but most importantly, leveraging the resources of our network. And earlier in my presentation, I said that this was a major victory for Virginia families. But this is also a major victory for my family, because my father is one of the nearly 400,000 Virginians who gained access to affordable and quality healthcare coverage on January 1st, 2019, as a direct result of our Medicaid expansion victory in Virginia. So I stand here on this stage as a grandson, as a son, as a proud Black queer millennial from the 7th Ward of Petersburg, Virginia. And I am proud of the steps our state has taken to create a stronger, more prosperous Virginia, the place that I proudly call home.